The agenda for this morning will see us sign the minutes for last year's AGM before we update you on our financial position and run through the work we've been doing over the last 12 months. We'll also take a quick look ahead at what we are aiming to do in the next year. It's certainly been a busy time when it comes to hearing people's feedback. Our staff have received nearly 5,500 different experiences through our face-to-face engagement, our phone service, online, and our various pieces of project work. There are a number of reasons for this high number. They include an increase in the number of engagement visits we've been doing, as well as collaborating with new communities to ensure we can hear from as wide a range of people as possible. As you will hear during the meeting, our entire team spent a week in each of Norfolk's major hospitals. This was a terrific opportunity to hear from hundreds of people and get some rich feedback. This is just one example of how we ensure everyone can have their say on the health and care that they receive, and that their views are passed on to decision makers. And this is not possible without the support of many people. Those who take the time to share their stories, our hard-working team of staff and volunteers who listen, analyse and report back on what they are, and the Health and Social Care Network who listen and respond to what we hear. All of this is vital as we continue our crucial role as a critical and independent friend to the Health and Social Care Network. Let us move on now to the business of the AGM. Firstly, can I ask for any apologies for absence? Judith.
William Armstrong, Cicely Scarborough, Bridget Penhale, Stuart Lines, Rachel Grant and Louise Smith.
Thank you. And can I now ask for the minutes of the 2023 AGM, which I believe are an accurate record, to be proposed and seconded. May I have a proposer?
Yes, can I propose? Thank you.
Thank you.
Yes, can I second?
Thank you very much. All those in favour? That's unanimous. Thank you very much indeed. So now I'll hand over to our Deputy Chief Executive, Judith Sharp, for the financial review.
Thank you. The Health Watch Norfolk annual accounts for the year ended 31st of March 2024 have been independently examined by Julie Grimmer of Larkin Gowan LLP, Chartered Accountants, in accordance with Part 4 of the Charities Accounts and Reports Regulations of 2008. This year's accounts show that total income for the year was £742,613 compared to £629,602 in the previous year. So that's up by £113,011. Total expenditure was £749,362, which is £35,903 more than the previous year. After gains on investments of £6,749, there was a resulting net deficit for the year of £475. Therefore, funds carried forward will be £325,964 compared to £326,439 in the prior year. Whilst this is a small deficit in relation to the size of turnover, it is still the intention of the Board of Trustees for Health Watch Norfolk to continue to work to produce surpluses to rebuild the reserves to the equivalent of 9 months operating costs within the next 2 years. 48% of the income has come from our core funding from Norfolk County Council, and we wish to thank our colleagues at Norfolk County Council for their continued support. We are pleased that the number of externally commissioned longer-term projects that we have secured has increased, covering important services and issues such as older people and adult social care, carers of people with serious mental illness, digital tools in primary care, and community health services engagement. We recognise that there is a great deal of work to be done to listen to the people of Norfolk and ensure their views are heard by the decision makers within the Norfolk and Waveney integrated care system. Statutory funding is not enough to enable all the work that we believe is necessary, and we therefore will continue to seek further commissions in a not-for-profit commercial fashion to ensure the voice of the public is brought forward. We are confident that we will be able to continue to have a positive impact on the health and well-being of the community that we serve. Full copies of the accounts are available on request and will shortly be published with both the Charity Commission and Companies House. I will now hand over to Alex Stewart, our Chief Executive, for his review of the year.
Thank you, Judith. So as Patrick mentioned earlier, we've certainly received a large amount of feedback this year on an incredible range of issues. And you can read more about the details in the annual report, which is being published today. We will be playing a video shortly, but that will recap sort of our work. So I won't go through everything in detail, and you will see more about this as we work through the video. Patrick mentioned our 3 Hospitals 3 Weeks project, which saw us gain a huge amount of rich feedback, which we continue to share with our colleagues at the acute hospitals. One of the longer term projects was My Views Matter. This was something we felt very strongly about, and it saw us visiting residential homes for people with learning disabilities and autism across Norfolk. The findings have been taken on board on a local level, which is what we wanted. Some improvements have already been put in place, but the work we did has come to the notice of key people nationally as well. John Spall, our project manager who led the project, has also had a paper published in the National Journal. While the figures of total engagement have been impressive, we did not want to rest on our laurels. Our engagement team have been working hard to reach 2 more groups in our communities. They have been a regular presence at food banks to talk to those using them about their experiences of health and care. We were also conscious that our feedback on social care needed to be even richer, and to that end we've been visiting care homes to talk to residents too. As well as being able to share feedback, the word is certainly spreading, and many more sites have actually asked us to visit them to talk to their residents as well. I spoke last year at this meeting about wanting to build in longer term relationships within the health and social care system, and that is something which remains a key focus for us at Healthwatch. This therefore allows us to work on shaping things for those who live in our communities in more detail. Let's now have a quick look back at some of the work that has taken place over the last 12 months in this review of Healthwatch Norfolk's last year.
The value of listening. It's at the core of what we do. Hearing from people about their health and social care experiences helps inform our work. Whether it's engaging with communities across Norfolk in care or community sites, helping people who call in to us, or working with different communities to understand their concerns in more detail, we need to listen to what people say and pass those views on to those who shape our services. Our role is to analyse and spot trends, act on feedback to drive change and improve services, and help make a difference to people's lives. We do this by working in partnership with care providers, the government and the voluntary sector. So just how many people have we spoken to over the past year? 2,540 shared their experiences of health and social care with us. 282 came to us for advice. And our team carried out 101 engagement visits to GP surgeries, pharmacies, libraries, care homes, community centres and community events. In addition, the entire team spent a week in each of Norfolk's 3 acute hospitals for the 3 Hospitals 3 Weeks project. In total, 5,417 experiences formed part of our targeted engagement and projects for the past year. As well as the general engagement we do, we also carried out some targeted work too. Because of concerns around pharmacy care, we visited pharmacies and dispensaries around the county, hearing from over 1,000 users and 46 professionals. While people were generally happy and thought they were treated well by staff, we did recommend better communication between GP practices and pharmacies. And pharmacies were also encouraged to talk to patients in multiple ways, including social media and text messages. One of our major engagement projects for the year was 3 Hospitals 3 Weeks. It saw our entire team spend a week each at the Queen Elizabeth Hospital in Kings Lynn, the James Paget University Hospital in Galston, and the Norfolk and Norwich University Hospital in Norwich. We visited as many wards, clinics and departments as we could, speaking to patients, carers, visitors and staff. Most were happy with the care they received, but there were concerns about waiting times, cross-departmental communication and parking. Talking of reports, we also published many more linked to our My Views Matter project, which saw us visit residential care settings for those with learning disabilities or autism. As well as publishing individual reports based on the feedback we received at each site, we also pulled together the key themes we discovered for a full report. We did hear a lot of positive feedback, and most people felt they had an avenue for ensuring their voice was heard, something that didn't happen at Corston Park, the site which triggered our work in the first place. There were some areas for improvement though, including the building of stronger relationships between staff and residents. Ensuring managers were well informed and engaged in the life of a home. Trying to make living spaces as personalised as possible for residents. And ensuring relationships are maintained for those residents with both their parents and immediate family and older friends. Other project work we got involved with through the year included getting the views of communities around proposals for a major trauma centre to treat some of the most serious injuries here in Norfolk. Finding out how easy people found it to engage with the Care Quality Commission if they were homeless or of no fixed abode. Discovering how easy people found it to access long COVID support in Norfolk, and the experiences of those transitioning from being looked after as a child to an adult within Norfolk Community Health and Care. The team also gathered feedback from people on the care they received at the Benjamin Court facility in Cromer, and carried out a training programme for the governors at the Queen Elizabeth Hospital in Kings Lynn. Our phone lines remained busy. Around a third of the inquiries we received were linked to difficulties accessing NHS non-emergency dental care. Because of this, we're gathering people's dental experiences over the spring and summer before holding a dental summit in the autumn to look in more detail at those issues. We also helped people with a wide range of other questions, which include helping to access bereavement support, helping a 16-year-old access urgent help as he was homeless in Norwich, advice on the rollout of prescription drugs or other treatment, difficulty in getting a prescription, helping a mum get support for her 8-year-old's anxiety, and even working with a surgery to improve its signage following patient feedback. Sharing public information and advice is also important, as well as our social media channels and our fortnightly newsletter, which reaches over 5,000 people. We also created content to help people understand what the new PSUF system is around looking into patient safety incidents and how people can help with this process. Continue to highlight the availability of free NHS health checks for the over 40s. Shared information about the Carers Identity Passport, which helps unpaid carers identify themselves in health and care settings. And also explained how people can now access their GP records online if they wish. The listening is going to continue for the next 12 months as we continue to engage with those with serious mental illness, their families and carers about their experiences. Our team will also continue their focus on social care, trying to talk to even more people in care homes to discover what they think about how they're looked after. Our project work will continue around accessing care digitally in conjunction with the ICB. And we're also going to be working with the Queen Elizabeth Hospital in Kings Lynn to help with the recruitment and running of their new youth council for 18 to 25-year-olds for its first 12 months. Whatever you want to raise with us, we're here to listen and gather the feedback of people across Norfolk about their health and care experiences, help them find ways of obtaining further support if they need it, and make sure health and care leaders hear what we're being told so they can shape future services. So please, keep sharing your stories and experiences to help us prioritise our work and help health and care leaders prepare for the future to provide the best services they can for you.
So what comes next? There's kind of no sign of the pace slackening for us. We're working with the James Paget in Galston to gauge people's views on the new Community Diagnostic Centre. Digital access to healthcare will remain a focus, and we're continuing our work with NH Norfolk and Waveney on looking in detail at this. The needs of those caring for people with serious mental illness will also continue as a priority, as we work with those in that position to understand the issues they face on a daily basis and what can be done to ease them. And we'll also be working on focusing with some of the younger members of Norfolk's community. Our engagement team are currently working on a project that will see them work with Norfolk Fire Service and other agencies across the county to talk to young people. And we're delighted to be working with the Queen Elizabeth Hospital's Youth Council and being involved in the associated recruitment of young people to join this council. Hopefully that will be up and running by the end of September, the end of October at the very latest. You'll see more about that at the end of the meeting. I'm now just going to pass back to Patrick to continue the business of the AGM.
Thank you. Thank you, Alex. Before I move into my final remarks, I just need to ask for if any questions have been submitted. We publicised the opportunity to give questions to the AGM on our website, online and through our newsletter for any questions to be submitted. If we had any questions, we would have either answered them directly or we would have published the question and answer on our website within 14 days. So without any questions, I'm now going to look around the room and ask if we have any other business. No, thank you very much indeed. Then I wish to conclude by giving my personal thanks to everyone who's contributed to the past year. My colleagues on the Board of Trustees, the staff, the volunteers, and everyone in Norfolk who's taken the time to share their views with us. And it would be very remiss of me not to give a particular mention to David Trevanian, my Deputy Chair, who has done so much to help us over a long period of time. He's taken a leading role in reviewing many of the reports before they're published, and his knowledge, wisdom, constructive suggestions and advice have helped shape many of the recommendations we've made across our health and care system. I'd now like to formally close the AGM by showing a video which highlights the Queen Elizabeth Youth Council project. This will aim to reflect the voice of the area's younger members of the community within the hospital to help shape things within the current building and the new hospital. Those aged 16 to 25 are being encouraged to come forward and get involved. We very much hope that this is a model which can be rolled out elsewhere. This video was put together by Finn Hanlon, videographer from Norfolk, and King's Lynn student Paddy Callow, who worked with Finn on a work experience project under the guidance of the team here at Healthwatch Norfolk. And they've produced a very polished video which we will now show you to formally end our 2024 AGM. Thank you.
This year, the Queen Elizabeth Hospital will be launching their brand new youth council made up of students, carers, young members of staff and volunteers in both the local community and the hospital itself. I'm here today at the Queen Elizabeth Hospital to tell you more about this youth council and how you can get involved yourself.
So the Youth Council will work with us as an organisation, they'll work with our governors, they'll work with our communities, and it's about ensuring that the decisions that we are taking are made with a cross-representation of our whole community, so from 16 to 25 but way and beyond, and that will be really, really important that the decisions are communicated well and we know what our communities want.
The Youth Council will be frequently working alongside the governors themselves, providing a new, fresh insight on how things should be run here.
It's very important that we have some young people come and help us and tell us about how they think the hospital's working. There's a million different jobs in the hospital here. I've got the word doctor in front of my name, but I'm not a doctor, I'm an academic. We need to help people understand that there are lots and lots of different routes into working in the hospital, which are not just doctors and nurses, although they are absolutely vital to us.
The hospital aims to open up the Youth Council to all roles within the hospital and the local community, roles such as young carers, assistants, porters, nurses, and all young people hoping to seek a career within the health sector. I've already spoken to some of the young people within the local community about the Youth Council to gain their opinions and insights.
Obviously, as the employment force goes up, we need more young people in it to eventually take over from the older people. And I think that if we have a youth council, it allows younger people's voices to be heard.
I think it would be really beneficial for the hospital actually. I think it's really important to understand the issues that young people face in the workplace, and having a better understanding of that could help to grow the workforce. We're an increasingly growing young workforce.
Not a lot of young people preach their voice out to say what's improved, what's bad, so on, whereas much of the older people or the previous generation would have done that.
It gives a more diverse range of opinions, and people from lots of different backgrounds can share what they think.
It helps people with disabilities get a job here, and they experience what the hospital's actually like to work in.
I feel like this would be a really key project to get people's voices heard, and people that may not want to speak up, there will always be someone there to speak up for them.
The organisers of the Youth Council here at the Queen Elizabeth Hospital aim for the council to act as a step up for all those interested in a future career in healthcare, providing a broad avenue for looking to gain work experience in a hospital environment. As well as this, the Youth Council provides a fundamental skill set for your CV as well as in your future career.
If you've got something like an idea, you want that to be heard, I would say definitely join and make your voice heard.
I think it would make it more beneficial for the employer, and it would help to mirror those values like wellness and kindness and fairness that we have here in the hospital.
Let's now hear from some of those key figures who have a hand in running the Queen Elizabeth Hospital to tell you more about why you should sign up today.
I think the idea of the Youth Council is absolutely fantastic. I think we need to get those fresh minds, fresh eyes into the hospital, and I think it's going to be absolutely amazing.
The youth don't always have a voice because the hospital settings normally tend towards the older generation, and sometimes in the NHS as a whole can miss the youth. And I think the way it's going now at the moment, the youth do need a voice.
It's definitely going to be that foot in the door, get that insight into how we work. When you've been working here for so long, you get stuck in those routines of how you work, and actually you need that young person or fresh eyes to come in to help change our ways of working as well.
Our new hospital is a really exciting project and opportunity. We need to be able to make sure that everybody has had their voice. So whether it's patient care, whether it's research, education, communications, we need your voice and we need it heard.
All applications to the Youth Council are open to anyone from ages 16 to 25 years old.
So please do think about joining the Youth Council. We think it's first of its kind in Norfolk, and we really, really appreciate your help in forming the youth voice for the hospital.
More information can be found here, and be sure to look out for more information on Queen Elizabeth Hospital's social media pages, as well as Healthwatch Norfolk's pages. All links can be found in the description of the video.
So if you're not sure, come and ask us, but do get involved because it's really, really important. We need you, and our future relies on all of us, but especially you. So please do come. It's really exciting. It's a new venture for us, and we want you to be part of it. Thank you.
Ben, thank you very much indeed. Well done. Congratulations. Thank you. With that, I declare the AGM officially closed. Thank you very much.